I'm John Giever with MedPage Today in Chicago for the Interscience Conference on Antimicrobial Agents and Chemotherapy. The infectious disease community has become increasingly desperate for ways to limit the transmission of bacteria in hospitals. The accumulation of bacterial pathogens on surfaces is one way in which the bugs get onto healthcare workers' hands and from there onto patients. Researchers have been looking at materials for covering surfaces on which bacteria grow that inhibit their growth. One of these materials is metallic copper. Dr. Michael Schmidt of the Medical University of South Carolina in Charleston reported a study here that tested copper-covered bed rails.
Unlike the cleaner who only comes in once a day, copper's always working. And so we asked the question, if we put antimicrobial copper surfaces on these high-touched objects, could we lower the burden to a level that would lessen the likelihood of the infectious microbes coming in contact with healthcare workers and patients? So it's a very simple question. You have plastic bed rails, you have copper bed rails, and you have patients in the bed. So this was a real world situation. Anyone who has ever watched people know that we touch everything constantly. And so we asked the question, and on average, the plastic rails at the beginning of the study, immediately before cleaning, had about 7,000 bacteria per 100 centimeters squared. The risk of picking that microbe up and infecting a patient has been set to be about 250. So the difference between 7,000 and 250 is pretty significant. While on the copper surfaces, the concentration that was routinely seen was about 693 immediately before cleaning. Then you clean with a common hospital disinfectant and the levels drop on both the plastic and copper bed rails. Makes perfect sense. But then we followed in time the plastic rails and the copper rails, and the copper rails were actually better at keeping the concentration of bacteria below that magic threshold of 250 colony forming units per 100 centimeters squared. In fact, 77% of the beds in the trial were actually below 250. 77% of the beds, while the plastic bed rails weren't.
Dr. Schmidt emphasized the importance of getting a handle on the problem of healthcare-acquired infections.
We lose lives. 100,000 folks will die this year in the United States from a hospital-acquired infection. Kills more people than breast cancer and HIV combined. And the really scary statistic is it's the equivalent of a jumbo jet crashing each day. Would the average consumer, if they knew that we were losing a jumbo jet a day, ever get on an airplane? Yet each and every one of us, when we are ill, go to the hospital. And the reason for that is the choice of life or death. We have a choice to get on an airplane because we can find some other means to get there. But in terms of getting ourselves taken care of when we're acutely ill, we must go to the hospital. And the overall risk of death being admitted to a U.S. hospital is about 1 in 400. So it's really pretty frightening. And if we now have good solutions, and antimicrobial copper in concert with hand hygiene and routine cleaning, together those three will combat this problem of hospital-acquired infections.
Of course, the important question about copper surfaces is whether they cut transmission to patients. Dr. Schmidt said that his group had conducted exactly that study, and the results will be reported at a meeting next month. In Chicago, I'm John Giever, MedPage Today.